Melanie Fourkiller, Senior Policy Analyst at the Choctaw Nation of Oklahoma.
Thank you, Chair McCollum. Thank you, Ranking Member Joyce and members of the committee. I bring greetings from Chief Gary Batten and Assistant Chief Jack Austin Jr. from Choctaw Nation. I'm Melanie Fourkiller, and I'm here to present to you the priorities for health care for the Choctaw Nation of Oklahoma. The Choctaw Nation is the third largest Native nation in the United States. We comprise over 230,000 citizens across the nation. We're located in extreme southeast Oklahoma, which is about 10 and a half partial or full counties in the southeast corner of Oklahoma, which is fairly remote and the highest poverty rates in the state of Oklahoma. I know earlier today you've heard about the lack of appropriations for 2019 and the effect that it had, particularly on health care, but also on BIA programs related to those that we operate. And I just wanted to add the Choctaw Nation's voice to that in terms of supporting advance appropriations for IHS. IHS and tribal health systems, as you know, were the only direct federal health care program to be affected by the partial government shutdown, and it really made us scramble in terms of how to provide continuity of care for our patients. It put tribes, frankly, in an awkward position of having to determine how to continue to administer these programs while we weren't getting paid. So how were we going to fund continuation of those programs in that interim? And so we certainly want to raise that to your attention. We look to your leadership and support as we go forward this year, and hopefully advance appropriations for IHS can be put on the table and really seriously considered. We appreciate that. We also thank you for your continued support of the joint venture construction program. Particularly in Oklahoma, we have no facilities on the big healthcare construction facilities list, which would take decades, as you know, under current rates of appropriation to complete. So joint venture is really a way for us to leverage both federal dollars and tribal dollars together to make those replacement and new facilities for underserved areas a reality. So one thing, however, that concerns us is that the Indian Health Service hasn't competed this program since 2014. It's very small and very highly competitive, and it's very highly successful as well. And we'd really like to encourage IHS to compete that on a more regular and frequent basis, at least biannually, so that high priority facilities can be addressed with the joint venture program in the future. We do have a number of other healthcare priorities, and we've written about those in our written testimony. I just want to talk about a couple of those to you today while I have the opportunity. One is graduate medical education programs. The Choctaw Nation of Oklahoma, we have a system of one hospital and 8 outlying outpatient facilities. We are very taxed, as we all are, with staffing, maintaining staffing for those facilities. Our hospital is relatively small, given as hospitals go. We're in a community of 1,100 people, so it is highly challenging to recruit healthcare professionals to a very, very small community with small schools, no housing, and lack of amenities that health professionals look to when they want to move to a community. So we started a graduate medical education program on our own with HRSA funds back in 2012. We have found that to be the single most effective recruitment retention tool for healthcare professionals for us to stay in our system, because if that, not only do they highly stay within our system, either at an outpatient facility or at our hospital, they will stay in rural Oklahoma and be practicing as our neighbors, which we also need to refer out for care and for just having the system of healthcare that you need in rural areas. It also has raised the quality of care, we believe, within our entire system because it causes our docs to be faculty. They have to remain up on all the latest and greatest notions of healthcare and be able to teach that to those residents. It is also a recruitment tool for those docs. They want to be in that kind of learning environment. So our pitch is that we really need to replicate these programs in Indian Country and have a steady stream of funding that's reliable for GME in Indian Country. So with that, thank you for the opportunity to speak, and I'll be happy to answer any questions you have.
Thank you.